Assalamualaikum warahmatullahi wabarakatuh, and good evening, ladies and gentlemen. So, in the next 15 minutes, I'm gonna try to share with you uh, a my hypnosedation experience in UMMC. And this is about uh, Datin B. And Datin B was referred to me by Dr. Mansor, who is a hypnotherapist, for a continuation of hypnosedation care. And this patient has uh, recurrent basal cell carcinoma on her forehead, and she was scheduled to be done under local anesthesia. The excision to be done under local anesthesia. And her psychological issue include uh, anxiety, phobia, and trauma of the upcoming local anesthetic procedure. Okay, hold on for a while. Again, technical glitch. Um, I, yeah. Yeah. So, this patient actually had multiple surgeries done before uh, under general anesthesia, and all of which she was very comfortable with and very receptive. So, however, for her last surgery of the removal of the basal cell carcinoma, it was done under local anesthesia, and this is the first time that she experienced surgery under local anesthetic. And she was traumatized when the local anesthetic was injected around the nostril region. So she described the experience as like being suddenly struck by lightning, and the pain exploded intensely and deeply into her brain and shook her entire system, and she was helpless to do anything. So because of that, she was emotionally not agreeable to do another procedure under local anesthetic and was initially insisting for general anesthetic, but was advised against it as her BP was labile during the previous GA. And furthermore, the case is a minor operation. Uh, Given her age and comorbids, the risk of GA uh, is a bit too high for a minor operation. Therefore, she finally relented to have it done under local anesthetic, but was very unhappy about the decision. So deep down, she was actually very scared, and she would be struck helpless as she experienced another repeat of the intense pain during local injection. So to prepare her for this hypnosedation, she had to undergo at least 3 sessions of hyp- uh, hypnotherapy before we subject her to the operation. And um, for the first session, it's about socializing to hypnotherapy model. So she was taught self hypnosis and became quite excited to know that this was a tool that she could bring with her into surgery to help empower her to control her level of pain and anxiety. And then the second session was done 3 days later. And this is about desensitization and trauma work. So in this session, one session of eye movement desensitization and reprocessing therapy, like what Dr. Lata talked to you earlier on, or also called EMDR, was done on the memory of the trauma of the intense local anesthetic pain. So what happened is we taught her, instead of resisting re-experiencing the explosive pain of local injection, that that's the one that is maintaining her anxiety, phobia, and trauma and whatever. She learned to confront the traumatic memory and open herself to accept and surrender to it. So after the EMDR, she was able to say, even if the same painful experience were to repeat with this upcoming surgery, I now have the resources to empower myself to cope better. So 5 days later, she had the third session, and this session is on hypnotherapeutic rehearsal of the upcoming surgery. So specific hypnotherapeutic protocols were rehearsed with her so that she can practice it. And she is now mentally prepared and even a bit excited to go for the surgery, knowing that she now has access to tools to help her induce self-hypnosidation. So on the day of the operation, in the operation theater, as a hypnoanesthetist, I guided her to self-induce herself into hypnosidation as rehearsed in session 3 during her surgery under local anesthesia. So the expected results are, of course, patient dependent, but with those who are hypnotically gifted, self-induced hypnosidation can bring about a GA-like experience without triggering risks of hemodynamic instability or respiratory depression that inherently comes with chemical anesthetics. But in her case, the blood pressure dropped a little bit when she's in trance or under the hypnosidation. Uh, uh, but it's not a big problem. So in this case, hypnosis serves as a sedative, but local anesthetic will still need to be administered as to induce anesthesia. So before administering hypnotherapy, we have to know a little bit about the patient so that we can put it in our script when we are trying to suggest the positive uh, goal. Yeah, and um, and for Datin B, currently her main goal in life is to live a life free of tumor. So when that happens, she will feel the lightness of being and enjoy good companionship and quality relationship with friends and family members, as well as enjoy spiritual connectedness with nature. She loved gardening and all that. So this is what she wants. This is her goal. And we are merely trying to help her to achieve all that. And then we also have to find out, are there any resources that are going to help us and help her cope with the uh, problem? So in her case, we are fortunate that she is a trained Reiki healer, familiar with healing energy ball technique, as well as pyramid of light technique. This is all her own techniques that she used. And because of that, we take advantage of this. And when we, in the hypnosedation protocol, we use this healing energy ball as during the induction. So during the induction, we uh, we say to her that you are already familiar with the arts of Reiki healing. Take this moment to silently repeat your usual Reiki mantras to yourself and connect to your higher consciousness. Come from the intention to open yourself to cosmic and universal energy and to allow this energy to flow through you and become concentrated as a ball of healing energy in between your palms. So we make her concentrate on that. And then we make her relax by going down deeper and deeper into trance. So we say, so ready? Taking the first step now. And we count 10, 9, enjoying the very beautiful scenic walk along your pathway. 8, 7, going down deeper and deeper. 6, 5, 4, feeling peaceful and tranquil as you move along the pathway. 3, 2, 1, all the way, deep, deep down, relax. Finding yourself at the end of the pathway, step off the pathway and step into your favorite place of relaxation. See the full beauty and vividness of the colors in your favorite place. Hear the gentle, peaceful sounds of nature. Feel the peaceful and tranquility of your favorite place. If the patient at this point does not appear to be in deep trance, meaning looking peaceful and motionless, but instead appearing to be a little restless, some minimal IV sedative, quarter to half the usual dose, can be administered at this point. But in this case, I didn't have to. She was nicely in trance. Then we have to then set up the dissociation reframes and add the time distortion and amnesia into the whole thing. And then I said, the beautiful thing about hypnosis is that you can remain in your favorite place. Your body to needs to be in the operating theater, but you don't have to. And so you can surrender your body fully in the hands of experts who will help you heal and become tumor free while you remain safe and sound in your favorite place. Of course, from time to time, you may become conscious of what your body is experiencing. Sometimes you may be aware of a certain tingle or warmth or pressure or tugging and pulling. But you pay no attention to these bodily symptoms and instead choose to refocus your attention back to your favorite place. And the more you choose to remain in your favorite place, the more control you have to push away any unpleasant sensations your body may experience. And because you are now more empowered, more in control, you will no longer re experience the administration of local anesthetic in the same way again. You pay no attention to your bodily symptoms, but instead choose to listen to the sound of my voice, the sound of my voice that will guide you to continue to remain deeply relaxed and deeply in trance. And then you add this time distortion thing and you say, and time will pass so quickly. Every passing minute will feel like mere seconds. Time will pass by so quickly that you will not even notice the passing of time. Before you know it, you will find that the surgery is already over. And there will be no need to remember anything that happened during your procedure, so that when you awaken, it will seem like you merely drifted off into a pleasant sleep of which you awaken feeling refreshed. So intraoperatively, you would tell her, in a few moments, time, the operating staff will take the necessary steps to prepare your face for surgery. You pay no attention to them as you continue to focus on the sound of my voice. And it doesn't matter how deep a trance you go into, you will always be able to relate to the sound of my voice. The sound of my voice that will accompany you throughout the entire procedure. So once the operation is over, you will then have to wake the patient up. And before you wake the patient up, you put this into their thoughts. Yeah. You will awaken feeling fine, refreshed, rejuvenated with a sense of pride and achievement because the tumor has been successfully removed. You look forward to living that life free of tumor to fully enjoy quality connections with friends and family members and also have a deeper spiritual connectedness with nature. Every part of you will be back here with me in the present, and all normal sensations will be restored to your body, except the areas which underwent surgery. These areas will continue to remain comfortably numb. So that recovery will be comfortable and painless, and you will awaken with a renewed sense of rejuvenation. So, ready? Ready to wake up? 1, 2, 3, waking up, waking up. 4, 5, 6, waking up, waking up. 7, 8, open your eyes. 9, 10, wide awake, wide awake, wide awake. So the hypnosedation and surgery was successful and she was discharged well. So feedback from her daughter revealed that she was satisfied with the procedure and was out and about in her garden in the same evening. See if we can watch the video. The sound? She had a bad experience. And I actually believe it was the result was amazing. And I appreciate to the fact that there was adequate direction and correct correction of patients as well. And I was amazed at how easy it was for me to actually have such a presentation, even though that was my first time doing it on in the hospital, because I really didn't take it on chronic medication. This is the first time I'm using it as hypnosis. And the result because of this memory of the research, when we did the upcoming surgery, we became very and that was before any hypnosis was administered. And after the hypnosis was administered, there was more. The same.
Somehow if you just had the confidence to face it, that it would be okay. No? It was not like before you sort of anticipate pain, you anticipate, it's going to be long time. And this time there was
This is completely different. I was like, but I mean, wow, what happened? This was on the day or something. You don't have to care. I knew. Right. After the operation, how much pain pills did you take? Not at all. Morning and it was a little bit of a pain, but it wasn't like I said, it was very marginal. I did not think you can take the and the next day, no pain ever since. What is your recommendation with regards to use of hypnosis and development? I think it was very effective because with narrative to be less worried, more educated about coming pain, you can take responsibility, what is your skill, and then you have to get, like everything. Your advice to the patient. I would say go for it together, as a general. You should have your responsible. Maybe the responsible. Let your tissue in the state on mind, to see what mind is without fear. With my confidence, and not be worried about it, and figure out that they all know what's happening. So if you want it, all of it, fear, very strong. So, in conclusion, research has shown that positive effects of hypnotherapy for acute and chronic pain reduction and management. And hypnotherapy can be added as a modality in pain management along with other treatment. So mind over matter is how thought processes can influence our physical reality. But in health, it isn't just mind over matters, but mind matters. Thank you.
Hello everyone. Okay. Good day. I won't take much time. Thank you for participating in this CME. So I'm Dr. Anand. I practice in a private practice. In my practice, I do apply hypnosis as part of my modalities anesthesia. So there's two things I do: acute medicine anesthesia in OT, and also chronic pain care. So in today's slide, I'm going to briefly talk about um, the, the anatomy, the basic science behind hypnosis, how it affects the brain and how it affects the pain pathway. I'm going to share few videos on my practice with some patients that I have on hypnosis. Yeah. So for good comprehensive pain management is a multidisciplinary, multimodality model to treat pain in a better way. So it addresses biological component, physiological component, and psychological component. So most of the time we are trained to handle the biological component with pharmacological agents. So the pain experience itself, we have a lot of pharmacological tools, drugs, emotional and modes of patient's experience. For example, there's a fear of pain itself, fear of exercising, fear of rehabilitation. So that component, most of the time, it's not looked at, and this can be supplemented by psychotherapy or complementary adjuncts. Another part of pain management is the behavioral component, social aspect of it, which is the cognition part of it. Some patients may have a feeling that since I have pain, I am not able to move, and they develop a maladaptive behavior because of that. So these two components are the part where we all know pharmacological agent has minimum um, influence, but is a major component in their healing process. So in this paper, it has been postulated the neuroscience basis of hypnosis. There are three main brain neural networks that's involved in hypnosis phenomenon: the salience network, default control network, and the executive control network. The salience network basically comprised of the dorsal anterior cingulate cortex, insula, amygdala. The default cortex is a dorsolateral prefrontal cortex. Lot of names there. Huh? So basically, what it means is the salient network is a part of the brain which decides what is important, not important. Should the patient or should I be focusing on something? So once that this part of the brain decides on that, it will send signal to the central executive network or the default mode network. For example, let's say we are watching a movie which is entertaining, it will send signal to the default mode network to say it's not important. The mind can start wandering, daydreaming, sense of self, creativity, and diffuse attention, which we all have during lectures. Another part of us is salience network when we are focusing on an exam. So it's a very focused state. So the central executive network comes into play, narrow focus, self-control, problem-solving mode. So this has been well researched and published in this paper. So what this simply means is the salient network decides which part of the brain um, to be in play. So the default control network is the part of the brain which says daydreaming. So it's active when a person is not focused on the outside world rather than the inside. Is a part of the brain which is active during wakeful period, rest, daydreaming, mind wandering, involve thinking about others, thinking about oneself, remembering the past, envisioning the future. It is turned off when we are active at work, when we are processing task. The executive control network, the dorsolateral prefrontal cortex, is an externally directed cognition, active when we are involved in high skill work. A set of cognitive processes that are necessary for the cognitive control of behavior involved in planning and decision making is turned on when decision making is required. So how does hypnosis affects the neurobiology of the brain? Hypnosis disconnects the posterior cingulate cortex, which is the default component, involved in self-reflection from activity in the salience network, dorsolateral prefrontal cortex. So what this means, it simply means that a person do not worry about things that is going on. Um, it helps to reduce exaggerating pain response. Simply means that a person does not ignore the pain but lessens the pain. So hypnosis is not a way to eliminate pain, but it lessens the person's response to pain, and with pharmacological agents, it supplements this process better. So this is a patient which has, I think we all face difficult IV cannulation. A lot of patients has chronic pain when it comes to bad IV experience. So in this video, I'm going to show you how I induce hypnosis very fast to insert IV cannulation. Um, we all know when a person about to be pricked in the hand, the response, the facial response will tell a lot. So let's see. So what I do is basically I get a person to focus on the movement of the hand. So by focusing on the movement of the hand, they start to daydream. Um, so if you notice the eyes, she seems to be sleeping, but actually she's not sleeping. She's just inwardly focused inside herself. So this lady is planned for a cesarean section, but she has 3 previous cesarean which end up with baby death of the baby. So it's traumatized her. So for her, Caesar means death. So any IV cannulation is death. So no one could insert IV line because of the fear. Um, so the way to hypnotize her was I helped her to focus on the sensation at hand, get her inwardly focused, and if you notice, the heart rate never changed. So she's quite comfortable. The Brenla is in, and she appears to be sleeping, but she's not sleeping. She's quite aware of the environment. So what does hypnosis do actually to patient? It induces an independence among the brain region, meaning that it separates the brain component of the brain functions. Because the brain is unable to synchronize communication, hypnotic states which you observe just now, they seem to be inwardly focused. That happens. And when that happens, it facilitates suggestions, which is typically not um, um, available in normal state. So this shift in function could explain the behavior change which you saw in the video just now. So another paper, can words hurt? So we all know when we insert Brenla, for example, simple procedures. I'm just referring to simple procedures. Brenla, we always say you're going to feel some pain, you're going to feel some hurt, you're going to feel this. So this do inflict pain before even the pain response starts to kick in. So in this paper, it has been discussed, many papers like this, words do have effective component in pain perception. So language has a role in forming experiences for patient. So positive languages such as relaxation induces calmness to patient. And this is what we call conversational hypnosis and a tool for effective communication. So how does hypnosis work is in tandem with these words. So we all know chronic pain. There's something called pain neurometrics. Pain experience is not from one particular part of the brain. It is not activated from a single region, but rather from various part of the brain interacting together. And that is why there's a dimensional component to nature of pain itself. So the pain processing activates a large area of cortical and subcortical network, the primary somatosensory cortex, secondary somatosensory cortex, anterior cingulate cortex, insula, the prefrontal cortex, cerebrum, thalamus, whole wide range of areas. So in this paper, the effect of hypnotic pain modulation on TMJ disorders. So what has been said is chronic pain activates key regions of the corticolimbic system, which are intertangled with regions of the pain matrix itself. It simply means that by using hypnosis in this paper says that hypnosis can alter the various networks, the default mode network, external control, attentional processing, anxiety processing component, and the sensorial component. Um, okay. So in this paper, it shows that cognitive hypnotherapy for pain management has a role. All right, I'm going to show you a quick video. This video, this gentleman, he is planned for cataract surgery. So normally cataract surgery is done under topical anesthesia. But two previous surgeries failed because the moment he lay on the table, he jumped out. He can't tolerate the claustrophobic environment itself. The moment the drape is on, um, he can't take it. He's not fit for anesthesia because he has developed severe anaphylactic reaction to to lignocaine infiltration in the past. So he has this thing. I need the surgery, cataract. He's only 45 years old. He has mature cataract secondary to chronic use of steroid to overcome the allergic reaction that he has. So the eye is important, yet I can't go for surgery because I have all these issues. So we discuss hypnosis could be an alternative. So he agreed to that. So there are two components here, pain and the surgery itself. So the first video is about he going through the hypnosis for the venipuncture, Branula, and after that during the OT. So I get him again to focus on the sensation around the hand. And as I get him to focus on the hand, I continuously give him cues, relaxation, suggestion. Um, and if you notice, the hand is not moving because he's already inwardly focused. He's not he's not concerned with outside world. So yes, he's aware of me applying tourniquet, doing all those things in the hand, but he's dreaming of something else more important. So in this case, I actually made him think of getting the eye vision back to normal, going back to his normal life. So that is very important to him. So focus on the eyes. He as the needle goes in, he's quite relaxed. So he didn't move, he didn't pull his hand, quite comfortable, easy to put in the cannula, easy to draw blood. So none of the blood investigation was done in the ward. We can't do. He didn't allow. So he's relaxed. All right. So for chronic pain hypnosis, when I use hypnosis for chronic pain care in my practice, I look at a few components. So we all know that it's the transition to chronic pain is marked by a shift in pain representation from sensory to emotional cognition. So chronic pain patients display maladaptive behavior that can lead to pain avoidance behavior, mood disorders, negative pain beliefs, and poor global quality of life generally. So what hypnosis does is it targets areas of the corticolimbic system, thus altering the emotional processing of the pain and the sensory aspect of the pain itself. But for some patients, it does reduce the perception of pain or the quality of pain itself. So what does hypnosis being defined as? In 2014, American Psychological Association defined as a state of consciousness involving focused attention with reduced peripheral awareness, characterized by enhanced capacity for response to suggestions. So there are three components here: absorption, meaning that to get the patient focused attention uh, on an experience. Disassociation corresponds to mental separation of usual state of mind. Suggestibility, meaning that to give suggestion to patients to relax, to suspend their critical judgment. So the basic method for hypnosis and pain management, there are three components which I normally do. The induction phase. Induction means getting them into a focused state of attention. Therapeutic suggestion. Therapeutic suggestion means telling that we do not use the words like do not focus on pain because that's where the pain will be focused. So use things like you'll be going back to home soon, you'll be eating back normal, you'll be walking around the ward, pain medication will be given, don't worry. I mean, those kind of things, positive thoughts. Then teaching self-hypnosis skills. So depending on type of surgery, type of pain, the teaching can happen weeks before the surgery or even on the day of surgery. So induction here means to help the patient relax. The second phase is provide suggestions. Emergence from hypnosis means simply getting the patient back to normal state of awareness. Hypnosis method, there are many methods. So in this paper for plastic surgery as an adjunct for conscious sedation, um, two commonly methods practice mentioned here is sensation focus method, focusing on a particular sensory or imagination of a relaxing place. Okay, this is this patient. He has chronic leukemia. He has chronic pain, plus he's retroviral positive. He's planned for bilateral cataract procedure because of dense cataract. He can't tolerate local anesthesia alone because his baseline heart rate is 140 to 150 when the moment he lies down. So again, the same approach. Sorry, hypnosis offered. So this is 2 hours before surgery. So what I do, again, the same method, focus on the sensation in the hand. So I ask him to feel numbness in the hand first. So the moment he feels numbness, then he will go into his own relaxation process. So this state is already inward state, meaning that he's aware of the hand movement, he's aware of his dreaming state, but he's not concerned with outside world. He's just relaxing by himself. So I do this, the moment the hand falls down, he's asleep. Um, so I get him practicing to do this to build his self-confidence that he can do this, to keep him in a comfortable state. This man is planned for, he has severe carpal tunnel with traumatic hand injury. He refused to go for rehabilitation process, physiotherapy, because his hand will always be painful. So they asked for my help. How can we help him to participate in physiotherapy rehab for his hand? So I make him imagine holding the exercise stuff and squeeze it slowly in his mind. He's not physically not doing it because he has the perception, if I physically do it, I'm going to have extreme pain. So we remove the real thing, practice in his mind. So he can hold that. Prior to this, he can't even straighten his fingers. He has the perception that my hand is useless. So the moment he can do this, he has a perception that I can bend my fingers. Therefore, I'm okay. So that's the first step into his process of healing. Um, then I will teach him how he practices the self hypnosis by himself to reduce pain. So throughout the whole process, if you notice, in my method, I use hands a lot simply because when they walk into the hospital, hands are cold. So there's a really cold perception there. So I utilize that. Um, cold is abnormal pattern. They do not have this at home. So they have this in the hospital setting. So I utilize this safe time for me. Okay, this slide is about a person. Yeah, sorry. She is a 50-something years old lady. She's planned for OGDS because of upper GI bleed, but hemodynamically stable. She has severe asthma. On that day of scope day, she has chronic wheezing. I mean, very bad wheezing, and so there's a concern. Sedation can cause respiratory issues. There's also a concern from the surgeon that if I put in the scope, she's going to react and going to get bronchospasm. So what can we do? So I use hypnosis, and normally we can supplement minimum sedation. But in this lady, we didn't use any sedation, but I use a lot of local spray. Most of the time, if someone who has asthma, there's certain fear if we spray, they can trigger asthmatic attack. But they're already spraying MDI. So that fear is not warranted fear. So if we manage that fear, they can go through. So the OGDS is relatively fast, simple procedure. So hypnosis help her in this way. Let me open the slide. So I got her permission to allow the face not to be blank so that we can see her face. So I use again the same method, focus on the hand. So as she's doing that, Then I quickly spray into the mouth, local anesthetic spray. So she's not reacting towards the spray negatively, so that's good. So I give generous amount of spray so that she feels the numbness. She can communicate, she can talk. Um, so any verbal response is encouraged. I get her to imagine she likes by the beach, seaside, relaxing there. She didn't like the taste of it, of course, but she can tolerate it. So that's the idea.
Hi, there's no video.
How long does it take? It takes about 20 to 30 minutes to prepare her. Because my aim here is not to give her any sedation at all. Right. So once she's ready, she goes in. She can cooperate with the people around her. She can obey commands. She's interacting with staff. Um, and as they're preparing her, she's going back to her own mind relaxation process. So normally we all know that when the scope is being put in, the initial part they'll be gagging. That is the difficult part for surgeons to pass through the scope. So in her case, she didn't gag. So you notice the scope will go through. Once it reaches the vocal cord area, it'll just go through smoothly into the esophagus. She didn't gag. Is she awake? Yes. The surgeon will be talking to her all the time. Um, so helped her. She recovers faster. No sedation required. No asthma like symptoms throughout the whole process. Yeah. All right. That's all. Thank you so much.
Okay, hello, good afternoon, everyone. So my name is Annapurny, and I'm a pediatric dentist and currently working at UITM dental faculty. So I'm going to be bringing some dental stories today. And as you know, I think dentists are the most feared people. And being a pediatric dentist, we appear to be big monsters to most of our patients because dentistry is definitely known as one of the most anxiety-inducing And I'm sure there are a lot of adults, some of you secretly are afraid of your dentist too, because I think we come from, a lot of negativity that says, if you don't do this, the auntie is over there, she's a dentist, she's going to pull out your tooth. So, dentistry has always elicited some form of anxiety. And, from a historical point of view, we have, now we have evolved, we have better dental equipment, we have nicer dentists, and, but yet the level of anxiety remains the same. If you talk about 1900, 2022, the level of anxiety, they've done a lot of research, remains at about 30%. 30% who outwardly can, portray that they've got dental anxiety. However, anyone who comes to the dental clinic, just because they don't jump off your chair, it doesn't mean they're not anxious. Almost everyone comes in with some form of anxiety, but we tend to control that anxiety. So in dentistry, many reasons on why we could have anxiety. It could be a bad experience in the past. A lot of our patients come in with multiple problems. So they're already seeing medical for different reasons, and always going in for blood tests, always going in for so many things. So they become much more anxious when they come to seek dental treatment. And the mouth is somewhat a very personal space. So I think it's quite you feel very embarrassed, very reluctant. So that's another reason why we have a lot of anxiety. And sometimes, unfortunately, it's a lack of communication, lack of empathy, and patients tend to be more anxious. And anxiety is definitely, it's a very vicious cycle, because someone who's anxious will then try to avoid treatment. When they avoid treatment, the treatment need then becomes more severe. The problem becomes more severe, treatment becomes more complicated. And when there's a more complicated treatment, the pain that comes along with it is probably also more. So this is a vicious cycle. And so patients who have anxiety end up having more dental problems. Patients with a lot of dental problems most likely have anxiety. Okay, so I'm not saying this, research is saying this as well. So this is a big problem that we deal with in dentistry. So my it was pretty much the story about how we started hypnosis in dentistry at UITM is because a couple of us jumped into a car one day, decided to go and check out LCCH because they were offering a course certificate in hypnotherapy. And so we decided to take up the certificate course. Most of us probably did it for personal reasons, not mainly for dentistry. It was more for personal reasons. But when we went in and we completed the course, we said, hey, look, I think we can help our patients. This is helping me, my self-care. We have different levels of anxiety. We have other issues. And say, if this is helping me, could it help my patients too? So then, and I must say, for many of you, when you first see it, you say, just speaking these words, how is it going to, even we had that sort of skepticism. But the good thing, I would say the positive thing is because we went as a team. I think if I'd gone in myself, I would have been reluctant because people are going to look at me and say, what are you doing? You know, so I didn't have that confidence to deliver like what Prof, because I'm so used to hypnosis. When Prof Marzida delivered, I was already getting into my zone because I'm so used to that. But so what we did in at my center, if I'm the operator, if I'm doing the dental treatment, my colleague is there, she will be the hypnotherapist. So that's how we sort of motivated each other. When she is doing her cases, I would jump in to be the hypnotherapist. So because we had that sort of teamwork, now I'm able to go out there and do it. Do it by myself. She's doing it. There are a couple of us there, and we are able to do it. But I think that was, for me, I believe we were very, very blessed because we had a team going and learning that together. So why it's been working for us? I think we started in 2015, I think 2014, 2015, and to now it has become like a daily practice for us. Initially, it was like, I used to have anxiety, or tomorrow I'm going to do hypnosis, is it going to work? But now it has been incorporated into my daily, how I approach my patient. That means anyone who walks through the door, sits on my chair, I'm not going to try to evaluate how anxious are you. I already offer them the positive language because that language is very important. And so patients who don't appear anxious as well, they benefit from it. You know, to have a patient on the chair, have a dental treatment and say, yeah, I enjoyed that. You don't expect people to enjoy your dental treatment, but it is possible. It is possible to offer a relaxed situation for these patients. So I use a lot of nitrous oxide. We use a lot of nitrous oxide at our place as well. And I started noticing that the results that I got with my patients with hypnotherapy is comparable to nitrous oxide. So when you deliver nitrous oxide, you will look at when you're adjusting, you will look at them and you will see the changes. You will see the changes, how they become more relaxed. You see the breathing pattern. I was seeing the same exact thing with hypnosis. So one is pharmacological and one is non. One is definitely more expensive. And, so when we started seeing that, we started using hypnosis as an adjunct. So we would deliver nitrous oxide, but also do hypnosis at the same time. Uh, so in the beginning, when we delivered nitrous oxide, after some time, what we did was we would turn back to 100%. So we turned the dial to 100%. Patient was still in that state of, for us, is a state of trance. But the patient was, it's as if the patient was receiving nitrous oxide. So when we turn it back to 100, so I had my postgraduates there, and at the end of the session, even though it's already 100% oxygen, we had to awaken. Like Prof Marzida said just now, she was counting 1, 2, 3 for awakening. 1, 2, 3, 4, awaken. It was only when I did the awakening that the patient is actually fully conscious. But patient is conscious, but in that state of, dissociative. They're there, but the mind is focused on something else. So when I do the awakening, then they're fully back. So after a while, we became confident. Hey, look, maybe I don't even need to deliver nitrous oxide. So we started doing that with the patients with positive results. And because, as you know, in dental treatment, sometimes they have to come for multiple visits. Some of you may have had root canal therapy. It doesn't get over in one sitting. You have to come back, and you have multiple teeth that need treatment or long-term, treatment. And for them to keep coming back and for you to give medication is probably, it's better if we could get them to be more relaxed. And so for all the subsequent visits, we are just using words. So what do we use it for? Definitely pain management. And to get an anxious patient to be on the chair to do, because it's not easy to get GA time. We can't be going in and out for GA for multiple visits as well. Okay, and in dentistry, we have habit breakers as well. A lot of them come in with thumb sucking, smoking, and so actually it does help with to quit certain habits as well. And we may have heard of like orthodontic appliance, patients who go in for braces, or sometimes it's an appliance. So when it's braces, it's fixed to the teeth. Appliance, we need the patient's cooperation and compliance to wear the appliance. If they do not wear it, you will not get the results that you expect. So sometimes being in young patients, we need to encourage them. So hypnosis, the good thing about hypnosis is you can instill these values. You can instill this for long term. That means, like what Prof said just now, you can include a message. Okay, when you go back, in order for you to have this successful treatment, you will remember to wear your appliance 8 hours a day or during this particular time. And it helps because it's subconscious. So you don't realize, you immediately take it and wear. You immediately do it. You don't have to keep reminding yourself. So in terms of that long term and for the daily thing, like to brush, to keep it clean, it can really have very successful outcomes. I am just going to, okay, this is how we do it. The setting, you can have it separately. You can have it in we are quite fortunate. We have a hypnotherapy room in dental faculty at UITM. So we can do that. That means like the prep. Remember some of the patients they showed just now, you have to prep them before, a couple of days before or a few hours before. Okay, so we can use that hypnotherapy room. And we also do chairside. So while we're working on the patient, we start talking to them, induce hypnotherapy. So a lot of cases we do, for me, I do a lot of chairside hypnotherapy. Or we can also send them home with some audio. Okay, I'm just going to do very fast some examples of how I use it. So I told you earlier regarding nitrous oxide, I use it as an adjunct because nitrous oxide also sometimes if the patient doesn't want to comply, the patient still has fear, it will not work. So by introducing together with the words, together with the nitrous oxide, I find that actually it's very much more easier to get a successful treatment. Needle phobia. I've had a couple of cases with needle phobia. Patient would scream and bring the room down. Okay, and I myself, this is one of my earlier cases, I was amazed that the patient was able to receive an LA before, because patient could not receive local anesthetic anywhere else before that. So the mother was completely, she was really, really shocked that her daughter was able to receive it. And all it took was actually speaking to the patient and desensitizing the patient. I've got one video here. This is one of my favorite cases. It's a patient with severe gag reflex. So what happens, and the patient needed some orthodontic treatment to correct his front teeth. And he needed to wear an appliance. And in order to do that, you need to get like a mold. You need to get a mold, get a model, and make this appliance. And this boy, if you put anything beyond his front teeth, you go in to check, the mirror, the dental mirror, you put it in, severe gag reflex. And and to take that, can you imagine taking an impression, putting something into the mouth, the patient could not tolerate. Even when you did the lower one, which is less sensitive, he would vomit. So how are we going to treat this patient if he cannot have anything in his mouth? How is he going to wear that plate? So the orthodontist said, we don't know what to do. It's a simple case to be treated, but we cannot do what we're supposed to do, which is take the impression and make this plate. So I said, give me a chance, let me try. So when I did with him, I did something known as a glove anesthesia. Glove anesthesia is that when I put him into hypnosis, I ask him to imagine that he has a special glove. And this glove, when he points or he touches any part, that part would become anesthetized. So he being a young boy and an Avengers, he's a fan. He says, I want to have Thanos. I want to have the Thanos hand. So I said, okay. So I incorporated that into the script that I gave him and I prepared him. And so I told him, whenever you feel like you're going to gag or vomit, use your powerful Thanos hand and anesthetize. So just touch it and that area will become anesthetized. And so I'm going to show you. Let's see. It's a short clip. Oh, there's no sound. Okay. Basically, I'm speaking to him. So I was telling him that okay, sekarang boleh gunakan tangan Thanos because you can see him. He's feeling a bit of a gag. And I told him, whenever you need, boleh pakai tangan Thanos. And you can see that he's putting his finger in. So he did not vomit, he did not retch. So he's using, he himself, his eyes are closed. So he's using his own fingers to anesthetize the area inside his mouth. We got the molds, we got the plate, we got him to wear the plate, and his teeth position was corrected. And the best part of it, the mother calls me up and says that he was having difficulty with swallowing tablets. He couldn't swallow tablets. I did this to help him with his dental mold, but it turned out that after that, he was able to swallow tablets as well. So that was really profound because we could actually treat him and something that we thought was quite impossible because of his severe gag reflex. We also use a lot of it. We get a lot of cleft lip and palate patients who come in demotivated. They have a lot of self-esteem issues. So I've worked with a couple of them and, it's really helped because some of them have major surgeries, and to recover from major surgery and to get on and to take care of the oral hygiene, hypnosis has really helped. We've also had trauma that we need to do something on the chair immediately because every minute loss means that that tooth loses its viability to be vital. So we replant teeth as well. So all this has to be done in a very, very short window. And we cannot be asking for GA to do that because you have to do it within an hour or so. And so when the patient comes in, patient this patient that we got was so um, anxious, and the only way I could actually do that work on the chair was using hypnosis. So basically, we were able to save teeth, we were able to reduce the dental injuries, and to manage it on the chair. And now he is fine. He generally has very severe anxiety, and you know that with trauma we have very long treatment. Patient has to come in very often, a lot of work to be done, and I'm happy to say that we've been able to give him the best because we were able to manage on the chair. Okay, something done yesterday actually by my team members, by my colleagues, is taking blood. Is something that's very difficult for us as well, especially with severe anxiety. You can see the boy, his head is slightly slumped down, very anxious boy. So they were doing a treatment where they extracted the tooth, and they ground the root of that tooth to put it back into the socket. We call it a socket preservation, which requires taking blood from the patient as well, and something that was quite impossible without the help of hypnosis. So there's some of the cases that I wanted to share, and to also tell you how we actually incorporating it. We have actually included hypnosis in both our undergraduate and postgraduate modules. So at UITM now, the students can come and observe. The undergraduate students come in and observe. They help us, and then they write a little bit of a log, a reflective diary, to learn about hypnosis. The postgraduates attend the course, attend the formal course, and they get a certificate at LCCH. And we also include it in assessment and exams to make it part. So basically, we've incorporated it into our module. So we are reaching out. I believe we are the first dental school to do that, but we are reaching out because we feel that we do have non-pharmacological behavior management that we teach. It's a big module for us in dentistry, and we hope that it will be something that every school will teach after this. I think it's just a tool that we should have in our pocket. It's up to you how you want to use it, but I think it's something that needs to be a tool that needs to be introduced to our students. Okay, I think that's it from me.
He's joining us from online. Okay. How do you do that? Let me just see. Okay. Oh, is this one? This one, right? Yeah. This one, right? Let me just see. Sure. Is he showing his? This is us. Maybe we stop sharing. Just need to find him. Maybe if there's a way we could locate him.
Can you open your video? Open your video and start talking, then you all will focus.
He should appear somewhere here.
Prof Rishya dah dapat. So kita stop presenting dulu.
Right in the room. Look at that cool room.
He said he was able to watch. Okay, thank you. Now I would like to invite Prof Rishya on a teleconference for the next topic. Are you? Yeah. Can you start speaking?
Hello. Good evening, everyone. Can you guys hear me?
Yes, I can hear you.
Yes. Thank you.
Yes, sir. Oh, okay.
Okay. So, thank you for yes. Thank you. Thank you. Okay. Okay. Terima kasih. Okay. Thanks. A wonderful CME program this evening. I would love to wanted to be there in live, but then I had something else to do. In a very short notice, I had to run. But I was listening to all the lectures earlier. It was very good. Most of the fundamental topics has been covered. I will just talk about some experience I have in doing hypnosis for our patients in emergency department. I actually work in emergency department, University Malaya Medical Center, and we do try out some patients with some of the modalities of hypnosis or other even other practices in patients. Uh, I just wanted to share some experience. One of it is some time ago, several years ago, we had a slightly younger child, was around 12 years old, brought in and then with a fracture radius, needed to have a reduction, CMR. And what happens is, as usual, the usual sedations was given by our colleagues who are managing the fracture, and patient immediately developed anaphylaxis. Anaphylaxis. Okay, I hear that Dr. Chwashini cannot hear me. I hope they can adjust the audio. I'll be very quick. This person actually, we lost this patient finally, and it's a sad situation because we shouldn't have lost this patient. So that's where it triggered me to find out, is there any other way that we can actually, uh, you know, deploy or employ in emergency department to at least find an alternative or reduce the usage of any of these medications. And that's where the quest led me to pick up hypnotherapy. And then onwards I started using on several patients. One of the very common patient that I use is patient having hiccup, a refractive hiccup, despite them having a normal result, not uremic, no viscous perforation, no reasons to think the diaphragm is irritated, but they end up having hiccup. And sometimes these patients having hiccup for days, and when they come over, some of them in a state of mind where they really want to give up. And in fact, one of the patient who told me they have seen three gastro, multiple treatment, right from enteral, parenteral, and multiple investigation, but they still yet have the hiccup. So I looked at all the results, and then see if any other possible reversible causes that we can correct. And since that's been taken care, I told the patient, can I try something with you? And then I've employed a very simple method, and we managed to take him to a room, and then and started doing an hypnosis, and then 6-7 minutes down the line his hiccup stopped. And then I also employed a method to reinforce and also gave him his own trigger, where if it happens again, then he can get there and try to do some trial on his own to help him out to stop the hiccup. And he came back after 1 week, told me that he had about 2 or 3 episodes, and he tried the trigger and then it worked. So I actually employ very simple methods. So similarly, reduction of fractures. We have used sedation. We have half the amount of sedation, because sometimes it's very difficult to go without totally any medication, but we have half the usage of it. Similarly, for patients, regularly I use for TMJ dislocation or shoulder dislocation. So these are the common areas that I usually employ the hypnosis technique, and it has helped me. So overall, I've reduced my usage of a medication, at least half of it, half the dose, and then the outcomes are good. And some of it we even teach them to repeat that on their own. At the same time, I've tried this on several other things. I'm sure the other speakers also have experience, like burn patients. Doing dressing on a burn patient can be challenging, so we do that as well in the department. Sometimes suturing. Sometimes they just need 2 or 3 suture, and they are with multiple medical problems. So the last thing you want to do is add on some medication to them. So I've employed some simple technique, and then with suggestions, and then quickly do it. So in a smaller way, one minute, boss, just 3 minutes, I'll join. In a smaller way, indications that I've used and successfully managed to repeat the indication, the solution is in shoulder dislocation or TMG dislocation. I've done on CMRs, quite a number of them successfully. I worked with my orthopedics colleague. Refractive hiccups is a place where we use, and then TNS suturing, wound dressing, and burn dressing. Burn is dressing, and sometimes in some of our patients who are having anxiety, when like for instance, even to get an emergency CT or some of them. In fact, my private practice, I do have patients who have claustrophobic, and then they were not suitable again for sedation and MRI under GA. We have used some techniques. And occasionally I do see patients post TKR, where I get referral frequently from one of our consultant when they have issues with pain beyond the regular pain, and issues with having doubts about getting back to feet and mobile. I've employed the techniques into getting them to early mobilization post-operation, especially post-TKR, post-THR. So these are the experience that I have. I use in ED. In terms of reliability and repeatability, reasonably simple, and it is reliable, and I managed to get a reasonable amount of good results. The benefit, the positive benefit is I have managed to reduce the amount of medications that need to be given to this patient with using the hypnosis as a adjunct to the treatment. So I think if we formalize this well, and if we get this properly formulated with all the team members today, like Prof Marzida, Dr Anand, Dr Srilatha, and then the LCH, Sheila and the team, if everybody opens up, and then if we look at it as an alternative adjunct where we can employ, where everyone is successfully using it. Back in UM is very famous. Prof Marzida using it, Prof Sarah, and a lot of them are already into it. So hopefully we will be able to get this to the next level. I think I will not take any longer. I just wanted to share this experience, that it is really real experience that I've used them, and it is all has helped my practice. In fact, even my private practice, I do get referrals for patients with refractive hiccups, and then anxiety, and patients with pain, especially musculoskeletal pain, or some of these fibromyalgia, those kind of patients who are having pain. where they are unable to control them, I do get some of them being referred to me. So there is a good, we can offer something to patients besides just medication. And if we formalize this and get KKM and everyone in our side, and if we get a guideline properly to how to do and how to propagate this, I suppose it will be good. Thank you to Dr. Lata, Datin Srilatha, who has taken an effort to organize the CME with IKN. Thank you, IKN, and thank you everyone, Dr. Anand, Dr. Sabi, Dr. Prof Marzida, and everyone. Thank you so much. I think I'll pass back to the Datin Srilatha to take over.
Okay, thank you, Prof. I would like to open the floor for any questions. Okay, I think end lah. Kita boleh end lah.
Dr. Lata, can I pass the floor back to you?
Okay, thank you, Prof. Dia dengar. Okay. Okay, thank you very much. On the screen there, we have shared the QR code for today's CME, and that comes to an end to 4 hours. Oh, it's off. Oh, okay. Okay, sorry.
Thank you, Datin Srilatha. Thank you, everyone.
What's the question? Oh. Okay, there is course being offered in LCCH in PJ, but if there is any inquiry, you can contact any one of us and we can help out with the introduction and so on. Okay, there's a question from Suraya Hani. So in Malaysia, there is various people as the speakers today and many more practicing clinical hypnotherapy in several university hospitals as well as in private practice, and also some in government hospital like where I'm doing, and so on. So the basic qualification, of course, for introduction, we have certification, but we have pursued further in diploma and advanced diploma in medical clinical hypnotherapy, addressing medical problems in patients, which will be useful in our day-to-day practice. And in this kind of courses, it's not just hypnotherapy, but you were taught tools and techniques and approach and even communication skills and rapport building with patients, which is the primary and first-hand approach to handling patients, of course. So with this knowledge, like other tools like cognitive behavioral therapy and EMDR and so on. So there's many tools that you will be taught besides just hypnotherapy, and all together in a nutshell, it will kind of give you a empowerment to improvise and come up with your own techniques in better outcome and targeted goals in patients. So you'll be taught on how to improvise and carry out according to the necessities in specific. It's very individualized actually. Yeah. And in fact, sometimes there are more complicated cases. Then once you can diagnose this, you can actually refer to more experts in that field. Mm-hmm. Yeah, answer already. Yeah. Saya cuba Q&A ni. Okay. think that's all. Okay. Yes.
Thank you for sharing. I just wonder how difficult or how easy is it with all the misperception going on? How easy it is or how difficult it is to convince patients to do this?
Oh, easy and convinced, yeah. But probably it could start off with awareness, like how we are carrying out this CME, and I hope to do a regular one in sharing case to case basis. And of course, from my experience, when I see patients in desperate moments, at that point of time when you're willing to help and like you can explain. That's why the communication and rapport is so important. Even those who are quite skeptical about hypnosis, when you start to quickly introduce in ED setup, you know, have to do things very quickly. A quick communication and rapport within that few minutes changes the whole ball game together, and we can alleviate the sudden acute pain at that instant. So in that desperate moment, patients do give a verbal consent actually, that in that situation, and that's how I achieve in acute setting. But of course, in chronic pain and all those procedures where our doctors who have discussed today, this would be introduced to them during counseling session prior to any procedure, and with explanation. Of course, there will be a lot of questions, and some people are aware, some are not. But with counseling and explanation, most of the time there's a good outcome. Yes, doctor.
You find that the criteria that it will be successful and it will only be yes. And the other one is and for the for his
Yeah. Yeah. Yeah.
And the third one is I'm interested in the MRI setting where we can use the hypnotherapy for the social population. But in MRI setting that we are not there in the patient. So how does hypnotherapy help in that sense?
Okay. You want to answer that? MRI setting? Anybody got experience?
So the first one was sorry, the criteria. Okay, I think so we actually have tools like hypnotizable and non-hypnotizable. We do have suggestibility tests that we can do, because it's what Dr. Srilatha said was not if they are completely against it and said I will not get hypnotized, then we cannot do it against their will. So in a way, when we explain, so the whole explaining and explaining the whole thing to the patient, there must be some intention from them that yes, I'm going to try it. So some of them, if they're purposely not going to close their eyes or anything, then they may not be able to achieve it. But most times even when they say this is something weird, I don't know about it. Most often, if they are okay because they want to help themselves. They need to get this MRI. Okay, this is something I need to do. There's no other medication. I'm just going to try. Most often, once they just close their eyes and go into that state, they sort of feel really relaxed. And this is a new feeling. And most often, they come back and say, okay, can you do that for me again? So I think from our conversation from the patient itself, if they're going to tell us, no, ini memang tak boleh, saya tak boleh, then most likely it's not going to work. I usually give them a test, but I said it's okay. You're here. Let's just close your eyes. I'm just going to count and then you come back. So sometimes I let them just go in for a while and come back because they need to think it. They like, okay, am I going to lose control? So you just let them go in for a while and come out. How was that for you? Can I go in a bit longer? So sometimes I explain mental as well. So that usually goes with that. But theoretically, they are tests for us to see whether we have some suggestibility test. Theoretically, it's like whether it's going they are good candidates or not. So far, most people are okay. Second part was the claustrophobia, the script, is it? Second part? Okay, script. We actually have scripts. We actually have a lot of we actually have scripts for many conditions. And like what I use in dentistry as well, I use the script. Sometimes I will translate because some of my patients are more they're more comfortable in Malay. I will do it in DM.
But the gist of it is that the idea is that we use a lot of metaphors. Okay, we go into the garden, and now because this garden has not been tended to, we're going to clean the weed, and after that we're going to put some baja, and then the new plant is going to grow. Metaphorically, but actually what we're saying is we remove all these negative thoughts and we allow, but we are talking about flowers, but actually it relates to something else. So when it's claustrophobia, also we have specific scripts. So we have all these tools. Sometimes we just have to adjust here and there. Just say we are talking about claustrophobia, there's something that the patient doesn't like, and that word appears in the script, we must make sure we erase it. That's why it's important to know what are their hobbies, what are their dislikes, what event happened in your life. So we know what words to use and what words to avoid. So, but there are a lot of scripts out there. So like at LCCH, we got scripts. Like for me now, I also subscribe to a group and they provide a lot of scripts as well. Sometimes when you're experienced enough, you know what is the main thing you want to address. We actually I write my own scripts. I write my own scripts because sometimes the scripts, the American scripts, they're talking about fairies. We are not used to that. Pari. So I don't use fairy. I use some, I'm saying angel. Sometimes the children don't relate to that. So I make it more Malaysian actually. So I do change some of the scripts, but basically we have resources for most of it. And what is the third one? I think this now is the script. Claustrophobia, yes, definitely, because we have scripts for claustrophobia and many techniques. One of the techniques is desensitization. Sometimes they relate it because they were stuck somewhere. So we desensitize them before the MRI itself or during the MRI. I've been for an MRI and I was very happy because I think I went into self-hypnosis. Most people are like, oh, I cannot stand that sound and it's so long. For me, it seemed like I went in and came out very fast, not 40 minutes. So. Because the time becomes distorted. So it will seem as though it's a very short time. So yes, definitely claustrophobia is one of those that can be tackled, and I think it would be a great application as well. Desensitization is a tool that is being taught. If you learn that we will do it before the procedure, and then during the procedure, the patient is already taught on self-hypnosis. So this is how we can address that. Can we refer our MRI patients? Yeah, we can do that. And like using like improvisation. So once you learn the basic already, then as doctors, eventually you will know how to use the words to tackle the problem. So like sports hypnosis, I'm not an athlete, you see, but then somehow I got involved with the underwater hockey team, and these are all students going for SPM and exams. They were so stressed out, and then they had this competition. So what I did is I gave them hypnosis to even address their exam, their studying, concentration, and then coming here, they feel very energetic. They play the game well and achieve the winning game. So I used all my own words. And surprised enough, after winning the game in Bali, they came back and continued here on weekends. And many of them got straight A's in the exam apparently. So I don't know if I directly or indirectly assisted them. So it's just a matter of how we improvise. And being doctors, I think it's very easy to actually learn and use that as a tool. So from basic hypnotherapy course in certification, when we go into the diploma and specifically the clinical medical hypnotherapy, the question I want to address is the difference. Why clinical medical is because we address all the cases we see in medical line, like bedwetting, insomnia, what else we learn, all these medical things that we see in hospital. Yeah, bruxism, sleep and those kind of things. So those topics were addressed, even psoriasis, skin problem, dermatology. So we address those many topics in medical line. That's why it's economic, clinical, medical hypnotherapy. So we address more to medical line. Yeah. One story, very. I realized story it's me lah. I had hyperemesis. I couldn't work for 2 months. It was really bad. I had difficult pregnancy as well. and there was something that really helped me. And my own colleague, another dentist, did the help me. It was quite immediate. I was actually able to go back to work because I stopped vomiting. It was on a daily basis. I moved from point A to point B. I would start vomiting, and it worked. It actually worked, and I was able to go back to work. So it's pretty much life changing as well because it allowed me to function. So a lot of points in my own life I've used it. But I was lucky. I had my friend. I just called up my friend and said, "Can you do it? Can you hypnotize me?"
During MCO, a lot of people had issues like staying at home and losing jobs, and students also, they were having a lot of trouble. And eventually, we also can do online. So since that during MCO and COVID, we did start online hypnotherapy that continued. In fact, some students, foreign students from our local universities like Taylor's and Hamid, I do online session for them to do well in their exams and memory and confidence and so on. Another person that I know that's practicing is the HOD of psychiatry in Sarawak, Dr. Ahmad Kabir. He practices hypnosis with very good outcome for depression and anxiety. Of course, for these patients, we have a tool, like we do an assessment of how severe the depression and anxiety is, and then how severe is the stress. They have some chart to do a checklist to gauge how severe it is, and then according to that, treatment can be done. Of course, as doctors, we start with medication, then we use this as a chart, and then we can actually titrate down the medication to alleviate the side effects of the medication. Yeah, psychosis or severe depression, because sometimes we do countdown and that brings you down, and then in severe depression you might just feel more depression. So these are the things that will be taught to you during the course, which is the right person to actually go further, which you should refer to a more senior person, like those lecturers who've been practicing quite some time. Then we would want to let those people with trauma, like in hospital, maybe they get scanned in like child rape and so on. These children will have childhood trauma when they grow up. But I think hypnosis plays a very important role to actually take care of the mental, emotional health also. And in cancer patient, what I see is personally, like say Breaking Bad News, first time we give a diagnosis to the patient, they will be so depressing, heartbroken, they say, "Give me poison, I want to die." Most of the time, that's the feedback when you diagnose cancer, right? Then after that, there's a journey on going for the chemo, painful. So I taught my MPs and nurses when they have interest, and they have this interest to learn also how to give iron injection without any pain or not aware of the injection. I've even done ABG on my colleague who's an emergency physician at Asma. He didn't feel the ABG needle, but ABG is painful, right? Yeah, he didn't feel the prick. So these kind, and then IV granular, these are the things that actually we do it lah. Yeah. I don't know if they can hear online with the mic. Yeah. Yeah. So I think maybe you can close the. Assalamualaikum warahmatullahi wabarakatuh, dan sehingga kini saya rasa sudah sesi CME kita pada petang ini, dan saya ingin mengucapkan terima kasih kepada para penceramah kita pada hari ini dan juga audiens kita secara online Google Meet, dan segala soalan rasanya sudah dijawab ya. Thank you atas soalan yang diberikan, dan ini saya selaku pengurus majlis ingin mengucapkan ribuan terima kasih kepada barisan penceramah dan juga pegawai perubatan yang bersama doktor dari pelbagai jabatan unit bahagian. Terima kasih diucapkan, dan terima kasih kepada semua. Assalamualaikum warahmatullahi wabarakatuh.